More Valley hospitals are getting access to rapid COVID-19 testing. Kaweah Delta in Visalia and Sierra View in Porterville using a test that can tell within minutes if someone has COVID-19.
Any employee, physician, resident that is symptomatic, we're doing all that testing ourselves as well, and being able to test in the emergency department.
Madera Community Hospital, another hospital rolling out a faster test. We spoke with them recently to find out how it works. We now bring in Karen Paulinelli, CEO of Madera Community Hospital, and Dr. Bach Roshan, an infectious disease specialist. Thank you two for joining me today to talk about the new rapid testing in Madera County. First off, if you could explain what the test is and what makes it processed so quickly as compared to some of the other tests that have taken days, if not a week, to process. Doctor, why don't you begin?
Yes.
Sure. Thank you. Thank you for having me and having us on this show. This is a test which is a PCR-based test. The COVID-19 can be diagnosed by blood tests like the serology test and the PCR test. This is one of the PCR tests, and it is the Cepheid Gene Expert machine, which uses the same platform that used to diagnose TB, Mycobacterium tuberculosis, another very common infection throughout the world and also in USA, in parts of USA. Now, the same platform of this machine is being used to diagnose COVID-19, and the principle is that of a PCR, and it just basically, the assay gets an answer for you in 45 minutes. There are different ways, different assays. Some are longer, some are shorter. This is a shorter version, and the full report is available in 45 minutes. So within an hour, you can give a result to your patient.
Which is fantastic because, of course, patients are very anxious to find out the results of these tests. Does it utilize the swab? Is this a blood test? What is the specimen that you need to process this?
Yes, it uses a swab. You are right. So basically the swab, it uses a swab. You just swab your patient. And the system is fairly automated. I mean, there is less role for any technician or other expertise which are required, and you put it in the machine, and the machine gives you an answer based on the real-time PCR, amplifying a part of the primer of the patient and matching that against the genome of the COVID-19. This has been a big success for us. It's very nice, and we're very happy with this because we are getting our results within an hour.
Yeah.
We used to wait 3 days.
That is fantastic. Karen, who is eligible to receive this test? Does a patient have to have some type of symptom, or who will be eligible?
So we have a pretty good screening process here at Madera Community Hospital that we've been working on with our physicians, and we are reserving it for, first of all, high-risk individuals. We definitely have a high priority for our patients that are admitted into the hospital. We want to be able to test them very quickly to know if they do have the COVID disease or not, so that we can better protect our healthcare workers and our doctors. And then, again, looking at institutions like skilled nursing facilities, those are definitely priorities, jails, prisons. But we also want to be able to have the ability to offer it to also people that come in. And we are reserving it for those with symptoms. So we don't want to, utilize all of our tests on people that are not symptomatic. And so we want to make sure that if people do come in to get tested, that they have a physician's order, or they're seen in one of our clinics and is evaluated by a provider, and it is determined that yes, indeed, they need to have the test. We just don't have enough tests to test everybody. We would like to have the ability to test anybody that comes through our doors, but we just don't have enough tests.
What do you see happening down the road, as this pandemic continues and maybe flattens, down the road? How do you see this impacting the community in Madera?
Well, I feel like we're going to be able to test more in the near future. And right now, like I said, we're doing only people with symptoms. But, you know, we've been waiting for these cartridges for this instrument that we have in our lab for quite some time. We were very fortunate to be able to get them this week. More test supplies, more cartridges. So we're hoping that those will come in the next couple of weeks. And I do believe, you know, from what I hear, you know, on the news and from our president, our governor, that more testing is going to be available. But we know that having the ability to test these people in our community really helps us have a pulse on what's really going on in our community.
Dr. Bach, Roshan, and Karen Paulinelli, thank you so much from Madera Community Hospital. We sure do appreciate your time today. Thank you.